Health insurance options after a divorce. Hello, I am Kevin Canals with MRMIP an independent health insurance agent in California. And when couples get divorced, lives are kind of torn apart, and many of the support structures we have within our life are kind of torn and ripped, and we have to rebuild those. And one of those may be health insurance. And it can be a bewildering landscape if all of a sudden you're losing your health insurance and you do not necessarily know where to go and what to do. So here are some different options for you. Now, when you involuntarily lose health insurance, let's say your former spouse was employed and providing the health insurance for the family, and you're no longer married, so involuntary loss, that is a qualifying life event for a special enrollment period into a number of different health insurance programs. So that's your ticket to getting into other health insurance in the middle of the year outside of open enrollment, is that qualifying life event of loss of coverage. Now, if your insurance was through an employer, you may be offered COBRA. And that is a continuation of your current health insurance. Now, the downside to COBRA is generally you now have to pay the full cost of that health insurance, which can be very expensive because group plans generally have a large network of doctors, and they can just be expensive. The nice thing about COBRA is if you're undergoing treatment, seeing doctors for anything, you get to keep all those doctors, and you don't have to worry about trying to find new doctors or anything like that. If you have already met the deductible for that COBRA plan, which is an continuation of the employer group plan, or the maximum out of pocket, it makes even more sense to keep the COBRA. If you've met the maximum out of pocket, then the health plan is covering everything 100%. So you may want to keep the COBRA if the health plan is covering everything, even if it has high premiums, versus switching and having to move through a deductible or a maximum out of pocket all over again. Keep the COBRA until an open enrollment period. Now, there is the marketplace of what we call individual and family plans. And most people recognize Covered California as the place to go for individual and family plans. Covered California is the Affordable Care Act Marketplace Exchange. And they determine people, make sure that they're eligible to receive subsidies from the Affordable Care Act to lower their health insurance premiums. And there's a lot of plans in there, and all of the carriers have their plans, so there you can choose from your bronze, silver, gold, platinum plans. There's going to be at least 2 carriers in different parts of Northern California and other places, and there may be 6 or 7 different options. But one of the things you do want to do if you go through Covered California is you want to check your doctors and hospitals, because again, if you're coming from an employer plan, they generally have a wider network, and the individual and family plans have a smaller network. So just don't assume that if you had Blue Shield under an employer group plan, that the same doctors are going to be in the Blue Shield individual and family plan. Okay, so you need to check on those. Now, the Covered California application can be complicated. It is income-based, and if you have children, there's just a lot of conditions. So I would strongly encourage you to work with an agent, a certified enroller, really take time to look at the application, because if something isn't correctly marked, one of the conditions isn't marked, or the income is incorrect, things can go sideways. They may say you're not eligible, or you're Medi-Cal or something like that. So it can be a little bit confusing, so work with someone. Now, all of the health plans that are offered through Covered California, you can enroll in directly with the carrier. You do not need to go through Covered California. You can go to Blue Shield or Kaiser or Blue Cross or Western Health Advantage, whoever you would like. And all you have to do is supply the qualifying life event loss of coverage document, and you can enroll in the middle of the year. Now, the plans are kind of essentially the same, whether you go direct to the carrier or through Covered California. But of course, if you go direct, there is no subsidy. And sometimes the individual and family plans through, without a subsidy are more expensive than COBRA. So you'll want to kind of make a spreadsheet on the paper and look at the different numbers, because you don't want to put yourself in a financial hole. If you are employed and your employer, your company offers group health insurance, you can enroll in the employer plan because you have a qualifying life event of loss of coverage. So you can enroll in the middle of the year with no problems. The employer generally makes a contribution to the employee, but generally not to the dependents. So if you have children, it could be expensive. However, if you are offered affordable group insurance, in general, you're not eligible for the subsidies through Covered California. So again, that's where it gets kind of complicated to kind of sort through all of that, what's going to be best for you, or if you have a child that is going through treatment. And sometimes people will be in different sorts of health plans. You may have an employer plan, but maybe you want one of your children in an individual and family plan, or something of that nature. And it's okay to mix and match that. And that is one nice thing of Covered California, is that different household members can have different plans. Someone can have Kaiser, someone else can have Blue Shield. But sometimes the monthly budget is paramount when you are divorced and conserving cash. One alternative, if your income is very low or you have no income, is Medi-Cal. And Medi-Cal is based on your income, and you can apply for Medi-Cal through Covered California. And if your income is low enough, or that also of your children, they will be considered eligible for Medi-Cal, and that information will be pushed over to your local county for the final eligibility and enrollment. Now, Medi-Cal, we call it MAGI Medi-Cal, Modified Adjusted Gross Income Medi-Cal, for individuals that are under 65 years old and not disabled. It has nothing to do with your assets, based solely on your income. $0 monthly premium, $0 for healthcare services, drugs, as long as it's on the drug formulary, are going to be covered 100%. So Medi-Cal, especially if you're not necessarily undergoing treatment or a particular health challenge where you need to see certain doctors, can be very good. It's going to cover you in an emergency. So if you're out biking or running or whatever happens to be, and you're in an accident, you're going to be covered 100% regardless of what hospital they take you to. So having the knowledge that you're covered for an unexpected accident or illness through Medi-Cal, and not having to pay exorbitant health insurance premiums, can really relieve the stress of, how am I going to make the budget? How am I going to pay the rent this month? Because you have health insurance through Medi-Cal, and that takes that worry off to the side, so you can just focus on rebuilding your life after that divorce. For some people, they may have Medicare, either because they're disabled or they are over 65. Generally, if you're receiving your health insurance through a spouse, and that spouse had group health insurance, most people did not activate Part B, because you have to pay for Part B of original Medicare. Part A generally is zero cost. So if you lose the group coverage, you want to activate your Part B of original Medicare as soon as possible. I believe you have an 8-month window to do it, but get a hold of Social Security and activate that Part B. So once Part A and Part B of original Medicare are effective, then you can look at enrolling in a Medicare Advantage plan or getting a Medicare supplement plan with a Part D prescription drug plan, and you're going to be taken care of. Now, Medicare is individual. If you have children, it's not going to apply to them. So you have to find some sort of other health insurance for the children. If you're low income and with Medicare, you can also apply for extra help through Medi-Cal to help cover some of the costs. Maybe they may cover the Part B premium. They may cover some of the costs of healthcare services through original Medicare, and Social Security through the Low Income Subsidy Program may cover your prescription drug costs. Other avenues for getting healthcare services after a divorce and you've lost that coverage. If you're a tribal member, the Indian Health Service, many people have access to that, and Alaska Natives, through the tribal clinics. The Veterans Administration, if you are a veteran, you can go to their website to see if you are eligible for veterans health care. The downside to both the Indian Health Service and VA is that you may not have facilities, close to you, but, hopefully if they are around you, you could lean on them until you rebuild things and get your income up to get some sort of other health insurance if you want it. I mean, a lot of people just have the Indian Health Service or Veterans Administration, and they're perfectly happy with the health care they receive. In California, we also have the Major Risk Medical Insurance Program, known as MRMIP, and it was very important before the Affordable Care Act in 2014, less so now. But if you are not eligible for COBRA and there's some other conditions, you can go through MRMIP. Generally, most people cover California works for them, or going direct to the health insurance company for an individual and family plan, because like those, MRMIP does not deny people for pre-existing conditions. And so that is one option. You can look into that if you're hitting some roadblocks on some of the other avenues. Continuity of care is important if you have lost your insurance from your former spouse and you have to transition to a new health plan, and you're undergoing treatment for a medical condition with doctors. There are continuity of care provisions in many of the health plans, the individual and family and the employer plans, and even Medi-Cal. And you can file the paperwork, and the plan must say, okay, you're being treated, we're going to cover it, and we are going to view the doctors as being in network even if they are not. So, for example, let's say you're receiving cancer treatment at Stanford and you segue into some plan in Santa Clara County, but they does not have Stanford in network. Continuity of care. You're being treated. Whatever health plan you select must treat those doctors as being in network and pay the healthcare services under the terms of the health plan that you select, even though Stanford isn't in the network. So that's continuity of care, so you're going to be covered there. So yeah, there's a lot of things. Health insurance is just not easy, but you do have options, so reach out, talk to people, to get as much information as possible so that you can make the best economic decision and healthcare decision for you and your family. If you have any comments or questions, you may leave those down below and I will do my best to answer them. Otherwise, for Insure Me Kevin, I am Kevin Canals.